Good evening and welcome. I'm Nora Kane. I'm the director of the Stanford Health Library, and it's my pleasure to have you here this evening for what looks like it's going to be a really terrific talk. Our talk this evening is a functional medicine approach to health, and our speaker is Dr. Susan Payrovi. Dr. Payrovi is a physician practicing integrative and functional medicine at Stanford Center for Integrative Medicine. She earned her bachelor's degree in microbiology and molecular genetics at UCLA and completed her medical education at UC San Diego in 2003. She completed a residency in anesthesiology at USC in 2007. Dr. Payrovi is board certified in anesthesiology, hospice and palliative medicine, as well as integrative medicine. She has additional training in functional medicine and acupuncture. So as you can see, this will be an interesting evening. And as we go along, I encourage you to use the Q&A function at the bottom of your screen if you have a question that you'd like to have Dr. Payrovi address, and she will try to address as many as she can tonight within our time frame. So without further ado, I'd like to turn the screen over to Dr. Payrovi. Thanks so much, Dr. Payrovi, for being with us.
Thank you so much for having me, and it's a pleasure to be here and to be able to speak about the practice of medicine that I've been pursuing over the last decade or so, because it has a very deep and personal connection to me personally, and it's something that I feel very passionate about sharing with patients. So I really appreciate the opportunity to be here. So today we are going to learn a little bit about functional medicine and how you can use functional medicine as a tool to create health. And this is something that I struggle with as a Western trained physician, because in Western medicine, we talk in depth about how to diagnose a condition and how to treat that condition with the use of pharmaceuticals or technologies like radiology or laboratory tests. You know, those are all part of that workup. In functional medicine, it's a very different approach. And rather than really just looking at treating symptoms, we take a different approach. So what is functional medicine? This is a good question because there's a lot of misconceptions about what it is. So I got interested in functional medicine after dealing with my own health issues and really wanting to find a better way of improving my health, which I felt was not being directly addressed by a Western medicine approach only. I felt like there needed to be something more, and I found it ironic that as a physician, I actually didn't know what the other tools were. So in my desire to figure out how I can do things better for myself, I came across integrative medicine, and from there I got interested in functional medicine. And the difference between integrative medicine and functional medicine isn't really important. But it is important to discuss that they are both very holistic systems of medicine, and they both really try to bring in evidence and data and to base therapies on the latest research that is available to us. So in functional medicine, what we learn about is a systems biology approach. So rather than thinking about the human body in terms of organs, we think about the body as various systems that all interact with each other and they all affect each other. And in order to bring balance to a person, you need to address all of the different aspects of a person. So you're going to look at the physical, but you're also going to look at the mental, the emotional, the spiritual, because they are all important. And we work at the root cause level, meaning that rather than trying to ameliorate symptoms by giving various medications or botanicals, we really try to figure out, like, what are the imbalances at the biochemical or cellular level that we can try to bring into balance. And there are 3 classes of therapies that I work through with each patient. So first and foremost, I'm looking at lifestyle habits. From my own personal experience as a patient and in my experience of taking care of many patients, I really believe that lifestyle habits are the core of health if you really want to improve your health. So if you can eat better, sleep better, exercise, manage stress, that's going to take you far. And I am really vested in giving people information that is not going to be a waste of their time, energy, and resources. So if you can really focus on improving your lifestyle habits, that might even be 90% of what it takes to improve your health. Beyond that, there are natural supplements, including herbal therapies, vitamins and minerals. And then the third class involves complementary therapies. So we'll talk about all three of those levels today to give you an idea of what it takes for you to improve your health, no matter what your condition, whether it's cancer, autoimmune disease, cardiometabolic disease, mood, skin issues. It's all really dependent on how you work through your day and how you treat your body so that your body can actually have a chance to heal. So when I talk about the power of lifestyle habits, I'm talking about what is happening at the DNA level, at the cellular, molecular level, at the biochemical level. And in functional medicine, we spend a lot of time learning biochemistry. So the concept of epigenetics is that it's the study of the external factors that turn genes on and off. So you can have a series of genes, but that doesn't mean that those genes are going to be expressed just because they're there. They have to be turned on and off, and there are various factors that do that. And lifestyle habits are some of the most powerful external factors that modulate the turning on and off of genes. And that should make you feel really good because you actually have a lot of control over what you're eating, how you're sleeping, how you're managing stress, how you're moving. And then there are some other factors that are a little bit out of your control. It might be trauma, whether it's emotional or physical trauma, infections, exposure to toxins. But these are the factors that help turn genes on and off. So what happens when these factors start interacting with our DNA? Well, as I said, genes are turned on and off, and that determines which biochemical pathways are turned on. It determines which hormones are secreted. It determines how your immune system is going to function, whether it's maybe going to upregulate inflammation or downregulate inflammation or turn on other pathways. And it really has a lot to do with whether or not you're giving your body a chance to heal. And we use the word heal a lot, but if you had to think about, well, how do you heal? Well, that's what we're going to talk about today. Like, these are truly the tools that are available to all of us to help us go on that path of healing. So we're going to start just diving right into lifestyle habits. And I generally like to start with nutrition. This is something that we all think about a lot, at least a couple times a day. And more people are really getting interested in, how do I eat better? How do I choose better foods? And I agree that it can actually be difficult to know what is good food or healthy food because our food system has become so complex. So food supplies the building blocks for every tissue in your body. Food supplies the building blocks for you to build energy molecules so that you can fuel your body. Food sends information down into your DNA to tell which genes to turn on and off. And eating is very dynamic. So what you eat today doesn't affect you next week. It affects you today within a few hours. So depending on what you eat, you are determining what information is being sent down into your DNA to turn genes on and off. So you can eat a burger, it looks like a veggie burger on the left side of the screen versus what's on the right side of the screen. Those two meals are sending very different information down into your DNA, and they're going to have very different biochemical effects. So the different biochemical pathways will be turned on, different hormones will be turned on, different levels of inflammation will be created just as a result of what you ate today. So if we had to break down what is the diet that you should be on, I have a generic answer for everybody. And so I teach nutrition in terms of very broad principles. And then your job is to figure out what works for you, right? So I always talk about a whole foods plant-based diet. And basically, this means that you are eating foods that are unrefined and unprocessed. You are eating these foods as they grow in nature, like what you see at a farmer's market. And plant-based doesn't mean you have to become a vegetarian or a vegan. You just have to try to get to at least 80% of your foods from plants. And plants aren't just vegetables, they're also fruits, nuts and seeds, legumes, whole grains. So we are going to talk about all of those foods that are available to help you get to that 80%. So people say, well, no, I want to be on an anti-inflammatory diet. Well, this is an anti-inflammatory diet because you are eating unprocessed foods without additives and added sugar, and you're eating mostly plants. So it's anti-inflammatory, it's high in antioxidants, and it's lower in toxins in comparison to eating a diet high in animal products. So there was a study called the BROAD study that was done, and was a controlled trial of a community-based program teaching whole foods plant-based diets. And at 6 months and 12 months, there was significant improved in weight and total cholesterol, right? And so they didn't put everybody on the same diet. They just said, here are the principles, eat within these guidelines. And within 6 to 12 months, people actually showed really significant changes that were very different from the control group. So I want to talk about vegetables because they are the true superfoods of all the foods that are available to us in the plant kingdom. So they are high in phytonutrients, antioxidants, and fiber, and lots of other great things. And I want to talk about phytonutrients in a little more detail because phytonutrients are these molecules that actually emit visible color. So when you look at colorful foods like a beet or red cabbage, blueberries, you are actually looking at the phytonutrient molecules that are antioxidants. Phytonutrients can also be anti-inflammatory, they can be cancer fighting, they can help stabilize blood sugar, they can actually help improve digestion. So this is why you want to really focus on phytonutrients. And so how do you do that? Well, you're going to go for color. And recently we've been talking a lot with everybody about eating the rainbow. So every day you will want to get all of the colors of the rainbow in your diet. So at least 1 to 2 servings. And you don't have to eat huge amounts, but if you can get a little bit on a regular basis of every color, that goes a long way. And one way to do that is to make sure you have at least 4 colors on your plate for every meal. And that takes a little bit of work, and you have to kind of get into the mode of looking for color when you're shopping, but it's not that hard to do. So for example, either you can get just the regular orange carrots, or you can get the rainbow carrots, which are going to give you the purple and the yellow. It's just another way to bring color into your diet. And then go for variety when you're eating vegetables. You don't want to eat the same 5 things over and over. I try to get my patients to eat at least 75 foods a week, although we should probably be doing well over 100. But if you can get to 75 to start, where you're giving yourself credit for every spice and seed and nut in that week, that's a great place to start. So fruits are also important to discuss because while they do contain a lot of phytonutrients because they are very brightly colored, they do also contain sugar. So my suggestion is to stick to vegetables and use fruit in conjunction with other really healthy foods. So if I make steel cut oatmeal with a bunch of nuts and seeds and spices, I'll put fruit into it just to sweeten it and to make it more palatable. Or we make vegetable smoothies and add some fruit to it to make it taste better. So you definitely don't want to overdo the fruits, and the best fruits are the berries because they have the least impact on blood sugar. Beans and legumes are great because they are a source of clean protein, which means that they don't have a lot of toxins in them. They're plant-based products, and there's a lot of good fat in beans and legumes, including omega-3 fats. Now, there's a lot of controversy about whether or not it's okay to eat beans and legumes because there is concern about some anti-nutrients that can prevent certain nutrients from being absorbed, like iron or other minerals. There's also concern of inflammation in the GI tract and a resultant leaky gut, which I'll talk about in a little bit. But I think if you can tolerate nut, beans, and legumes, they're great to have in your diet, especially if you're trying to be plant-based, because they'll help keep you feeling full longer. And they're a complex carbohydrate, which means it is a large carbohydrate molecule that is hard to break down. And so there's no quick spike in insulin and blood sugar when you consume them. Now, some ways to improve digestibility is to soak them, rinse them, pressure cook them. You can even throw a piece of seaweed called kombu into the water that you're cooking the beans with, and that helps. I also love sprouting beans because it's fun to watch them grow. Kids love it. And you can eat the beans raw, like you could throw them into a salad or saute them. So it makes it very easy to digest. So think about bringing more beans and legumes into your diet if that is something that you enjoy and you tolerate it well. And sometimes starting with lentils might be a good place to start because they're generally pretty well tolerated. Nuts and seeds are also really important because they are also clean protein and good fat. They keep you full. So if you're eating a bunch of vegetables, if you add nuts and seeds, you'll stay fuller longer. And you probably don't want to overdo some of the nuts and seeds that are high in omega-6 fats because that balance between omega-3 and omega-6 is important. But about a handful a day of nuts is great, and a couple of tablespoons of various seeds is also a good amount to have in every day. So down on the bottom, on the left, we have chia seeds. In the middle, we have flax seeds. And on the right, we have hemp seeds. And I just mix them all in a jar. And I have sesame seeds and pumpkin seeds and sunflower seeds. I have them all in a jar and they're ready to go when I need to use them on a salad, in oatmeal, in yogurt. Then I don't have to open 6 different containers. Now, most people do a good job of eating nuts because they're familiar and we know how to eat nuts, but seeds are somewhat unfamiliar to most people. So you can just throw them into anything. They're generally very neutral tasting, and a couple tablespoons every day over many weeks and months adds up to a lot of good protein and good fat. All right, so I want to talk about whole grains or just grains in general. The standard American diet tends to be really high in grains. So we're eating a lot of bread, a lot of pasta. And there's a few issues with that. First of all, a lot of the grains we're eating are white grains, so processed grains, where they've kind of broken the grain apart and they're just giving you the endosperm. That's the carbohydrate-rich part of the grain. So if you're going to do grains, look for whole grain to ensure that you're getting the entire grain and not missing out on a lot of the nutrients, and also not going to get this big spike in blood sugar. So go for whole grains. And it's really actually hard to know what is a whole grain. And I don't recommend reading labels because it is almost impossible to tell what is a whole grain. So in the upper right-hand corner, I have this picture of the Whole Grain Council's sticker that you might see on a different packages of bread or pasta. So that will ensure that you're getting a whole grain product. Choose organic because grains are heavily sprayed with pesticides. There's a lot of concern about grains, especially gluten, which is the protein found in wheat, barley, and rye. The concern is that you can get inflammation in the GI tract and permeability in that lining of the GI tract, which leads to an unintended activation of the immune system. So there are studies that show that both gliadin, which is a protein found in wheat, and wheat germ agglutinin, which is a lectin. They can both cause GI inflammation. So there are human studies that show that gliadin molecule can actually lead to leaky gut or hyperpermeable gut in some people, meaning basically that barrier in the GI tract breaks down and then you get your immune system overactivated. So while I don't think the whole world needs to be gluten-free, I don't think that grains should be a major part of our diets because they're just not nutrient dense. And if you want to prove that to yourself, just go gluten-free or grain-free for a few weeks and you will see that all of a sudden you will start eating a lot more vegetables. Okay, and then we should talk about fats because there is this confusion around what's a good fat and what's a bad fat. Well, first of all, we all know that omega-3 fats are really anti-inflammatory. Studies show that omega-3 fats can actually inhibit arachidonic acid, which goes on to produce these inflammatory molecules. So omega-3 can actually inhibit this inflammatory molecule. And there are some studies that show that omega-3 and omega-6 fats can actually inhibit the growth of prostate cancer cells. So the problem we have in the standard American diet is that there's not enough omega-3 and there's too much omega-6. And when there's that imbalance with too much omega-6, our biochemistry goes towards the production of inflammatory molecules. So what are some of the good fats that should be in your diet? Well, omega-3, omega-6, omega-9 are all great. There's a lot of controversy around saturated fats. Some of them, like coconut oil, can actually be metabolized to other healthy fats. So I think in moderation, they're fine. Even the saturated fat in animal products, we think is maybe not as bad as we previously thought. It might have the problems we see with saturated fats might be more to do with the inflammation occurring as a result of heating that fat and changing some of the chemical structures. So if you're going to focus on good fats, you're going to eat nuts and seeds, beans and legumes. You're going to focus on oils like avocado oil, olive oil, coconut oil. Fatty fish is great. And you generally want to focus on the smaller fish, such as mackerel, sardines, and herring, because they're going to contain less mercury in them. All fish now have mercury because that's what's in our oceans. And if you want to eat more seafood or you want to make sure that you're getting sustainable seafood that's low in mercury, go to seafoodwatch.org. It's a wonderful website and very easy to use. And then also grass-fed, grass-finished lean beef is not a bad option. Now you don't want to overdo it, but small amounts of grass-fed beef with lots of vegetables around it, where at least 80% of the real estate on your plate is plant-based, and then you have a little bit of beef, is fine. Okay, and then we should talk about fiber because it plays so many important roles for us, and the American fiber is really low. The American diet is really low in fiber. So fiber is important for cholesterol metabolism. It is important in detoxification, which means how we get things that are unwanted out of the body, like hormones, toxins, medications. And so they support GI function so that you can have regular elimination. Hopefully, a daily bowel movement is something that's really important to work towards if it's not already happening for you. And fiber supports your microbiome, which is the collection of the good bugs that live in your GI tract that do a lot of functions for us that we don't know how to do on our own. So it's really important to get the fiber in there to improve the microbiome diversity and also improve gastrointestinal health. So the minimum requirement is 25 milligrams a day, but we're overachievers. So we do 30 grams a day of fiber minimum. So start slowly if you're not getting that much. Make sure you're drinking water as you increase your fiber intake. And most of us think about fiber as what's in the picture on the left, where it's a lot of grains and nuts and seeds, but there's a lot of fiber in vegetables. So getting a variety is really important because the more variety in the fiber that you consume, the more variety you will have in the bugs that grow in your microbiome. And variety is really important. So I've been saying the word variety since, I started talking. So variety in nutrition is super, super important. And to kind of drill down a little bit deeper on the microbiome, how do you support your microbiome? These are the good bugs that live in the large intestine that keep us healthy. So there are foods you can consume that contain the good bugs. So these are fermented foods, not pickled, but fermented, where there's actually a good concentration of these beneficial bacteria. So this is yogurt, kefir, any fermented vegetable, or kombucha. You can also take a probiotic supplement, but they're expensive and you're not getting the variety of bugs that you can get from food. And I think a food first approach is always the way to go, because the long-term strategy can't be the use of a supplement for everything. And then we talk a lot about probiotics, but we don't talk about prebiotics. And these are foods that are fiber containing, but they contain the right kind of fiber that feeds the good guys. So you're selectively allowing the good bacteria to grow and thrive and take hold of the large intestine. Some of these foods you're probably already eating, like onions and garlic, but there are many other foods, and a lot of green leafy vegetables, for example, bananas, kiwi, are part of these foods that are prebiotics. You can also take a prebiotic supplement, but again, I think it's better to just get it from food. So there was a randomized controlled trial that showed that people who consumed diets that were higher in fiber actually ended up growing more of the bacteria that produced short chain fatty acids. And these people had a significant drop in their hemoglobin A1C, so their blood sugar improved. Okay, so this is just one intervention that you can do to help support blood sugar regulation. And this isn't important just for diabetics. Actually, when blood sugar metabolism falls apart, a lot of inflammation follows. And so this is really important for all of us to think about. I'll also, while I talk about nutrition, we'll also talk about fasting. Fasting has many benefits, and there are many different regimens of fasting, which I won't get into today. But fasting allows us to help bring regulation to the immune system. So if there's an autoimmune disorder and you want to bring more regulation to the immune system, one strategy is to do regular fasting. Fasting also leads to autophagy, which is a fancy way of saying when the GI tract remains empty, you start clearing out old dysfunctional cells and allowing new cells that are healthy to come into circulation. So you're working towards a healthier system. Fasting slows cellular aging. It turns on your antioxidant genes. Blood sugar improves. There are some really interesting studies that show that a really strict fasting regimen with very close follow-up of blood sugars has led to the resolution of like a diabetic state in people who've had diabetes for decades. So fasting is really an interesting tool. And other benefits are DNA repair, tumor suppression. I mean, and I think what this shows us is that when we eat all the time, in our society, food is available to us all day long. We eat 3 meals and we snack between all of our meals. The GI tract never has an opportunity to be empty so that it can clear things out and repair. And so this is why it's important to allow for this empty period so that you can improve GI health and get all of the benefits that you see on this slide. So when thinking about nutrition, some additional things to think about are choosing organic, because you don't want those extra added pesticides. You want to avoid genetic modification. You want to avoid sugar. And getting things that are seasoned, local, and fresh is really important. So support your local farmer's market. And if you are buying things that have labels, make sure you read the labels, you read the ingredients. And if you can't pronounce the ingredients, I would just skip it. Okay, so we're going to transition from talking about nutrition to exercise. So exercise is one of those tools that will change your life. Even if you haven't grown up exercising, was not a part of your upbringing, it's never too late to start. because we know that exercise, especially exercise of higher intensity levels, is probably one of the most potent anti-inflammatory tools we know of. And it's an immediate mood booster. And if you have ever experienced the effect of, finishing your workout, you might feel elated, your anxiety might improve, low mood might improve. I've never had anybody exercise and have a worsening of mood. And this is something that Western medicine can't do. I mean, we don't have any immediate mood enhancers as pharmaceuticals. Exercise helps you build a healthier microbiome. It supports detox. And if you want to keep your brain healthy, by far the most useful tool is exercise. So there was this interesting study that showed that they took patients with neurodegenerative diseases like various dementias, Parkinson's disease, and they put them through an adaptive exercise program. So an exercise program that was tailored to what they were capable of doing. And at 8 months, these patients actually showed that they maintained their motor function and delayed overall progression of their disease. Now, with neurodegenerative diseases, once they're diagnosed, there's not a lot of great therapies out there. But, to get this kind of a benefit from exercise, I think is really encouraging. And in this study, I think 2 people even had an amelioration of their symptoms, which was really interesting. So the goal is to move every day, start low and add very slowly to make sure you're being safe, and just find something that you enjoy. Otherwise, you're not going to do it. So if it involves doing it with a friend or listening to a certain kind of music, just make sure that it's something that you enjoy and that you look forward to. And try not to do the same exercise every day. If you're a walker, maybe you can incorporate some weights, do some strengthening exercises. It's really great to challenge your body in different ways. So the next lifestyle habit we're going to talk about is sleep. And sleep is very, very foundational. And I can tell you from personal experience, it was one of the most profound changes where I entered a stage in my life where I didn't have to stay up to take call, and I didn't have small children, and I could sleep, and I just became a different person. And I think many of us feel that getting 5 to 6 hours a night is normal and we feel fine. But I think I would challenge you to try getting 8 to 9 hours of sleep. You might really love it, and it might just be the thing that really helps change the trajectory of your health. So some of the functions of sleep is to repair and regenerate various tissues in the body. There's detoxification that happens. In fact, the brain detoxes twice as well while you're sleeping versus during the day. And if you want to get junk out of the brain, like toxins that may get into the brain and cause inflammation and lead to something like Alzheimer's disease, one way to support that is to sleep so that you can clear some of those problematic compounds through detoxification. Hormones balance when you're sleeping better, and this is actually something that will just fall into place if you get into a regular sleep pattern. I generally tell people to aim for 8 to 9 hours and be asleep during the dark hours, because you want to be in line with these shifts in the 24-hour cycle. It's also really interesting that there's this crosstalk between sleep and the immune system. So sleep affects what's happening in the immune system. And so if you want to bring your immune system into regulation, sleep is a really useful tool. And we don't have Western medicine equivalents for what sleep can do. Good sleep allows you to form more solid memories and also to process your emotions more appropriately. So in a study, they took sleep-deprived participants and showed them some images that were negative in content, and compared to non-sleep deprived participants, the sleep deprived people actually had greater activation of the amygdala in response to these images. So this speaks to that processing of emotions. And if you've ever been sleep deprived, you may recall being snappy or, having less patience. And when you're well rested, magically, everybody's nicer around you and you're nicer. So it's just something I think to pay attention to, because it's really fascinating how sleep affects so many different parts of how we function. And I think it's really important to get a sleep bedtime routine going. It's really the foundation of restorative sleep. So as I said, you want to aim for 8 to 9 hours at night. Be asleep by 10 o'clock at the latest, and then maybe get up by 7 a.m. And this will help you get a good spike of melatonin at night around 10 p.m. And you wake up at 7 a.m. within about 45 minutes, you'll get a nice spike in cortisol, hopefully. And this is one very powerful way of bringing your hormones back into balance. If you're using pharmaceutical aids long-term, I would highly recommend using them very sparingly, because there was just the recent data that came out of the Women's Health Initiative showed that the use of pharmaceutical sleep aids increased all-cause mortality and cardiovascular deaths. And what's long-term, it's not really clear, but I would say like once every third night for many months. And if you're using that long-term, it can actually have a lot of very significant health effects. So there are a lot of natural options that are out there. Naps are great. You just don't want to do them too late in the day where they interfere with sleep at night. And then here's the hard one, avoiding screens the last 2 hours before bed. And we're all guilty of this because that's that last hour where we want to relax and do something, that we've been kind of wanting to watch, a show or something. But if you can reserve all your screen time for earlier in the day and then read a book, listen to a podcast in those last 2 hours, not being exposed to that harsh blue light will help you get deeper, longer, and more restorative sleep. And if you don't believe me, just try it. Try a couple of nights where you're not using your phone and see how you feel the next day, and compare that to the nights where you're using your phone regularly and you're on your phone for hours before you try to fall asleep. So see how long does it take you to get to sleep, and how long do you sleep, and how do you feel the next day? If sleep apnea is an issue, for example, if there's snoring or there's any daytime sleepiness or fatigue, it might be really important to talk to your doctor about whether or not getting tested for sleep apnea is right for you. All right, and then we'll talk about stress management here, because I think most of what I see in my clinic, whether it's cardiovascular or autoimmune or cancer, I think a lot of it is driven by stress. And this is maybe the hardest lifestyle habit to kind of get a handle on, but I think it's really important if you truly want to make progress and improve your health. So my strategy to stress management is, first of all, what are the stressors that you can remove out of your life? Is there a person that is perhaps bringing a lot of stress into your life? Well, can you minimize interactions? Can you build boundaries? Maybe your house is really cluttered. Maybe kind of getting rid of stuff will help kind of make your space more comfortable. And then build resilience by sleeping better, exercising, practicing good relationships with those around you. There's many different ways to build resilience. And then there's calming techniques such as meditation or just breathing practices, or just being mindful and in the moment when you are going about your day. I would also give you credit for prayer or engaging in a hobby or exercise if they truly help you manage stress and you feel better and less stressed after you practice them. And I don't recommend just jumping into a 45 minute a day practice. I don't think that works long term. I think it's something you have to build. So start with 3 minutes a day. Do it every day. And if you love that, then increase it from there. But I'd much rather see people meditate or breathe a little bit every day rather than doing 45 minutes once a week. It's the pattern of doing it regularly that helps calm the nervous system down and bring you out of that fight and flight response. And, being in a less stressed state matters. In this randomized controlled trial of pregnant women, they took a group of pregnant women and put them through cognitive behavioral therapy versus controls who didn't get that. And at the end of the study, the pregnant women actually had significantly lower stress scores. Does that matter? Well, of course it does, because when there's a stressed mother, there is the release of hormones and other neurochemical activity, and all of this will affect the fetus. And it's actually really interesting because this emotional state of the mom can actually affect which genes are turned on and off in that baby. And interestingly, that can actually be passed down through generations. So if you haven't given much thought to stress management, I think it's really worth it. And we're talking about a lot of different tools today. And the goal is not for you to pick all of them, to choose something from all of the different lifestyle habits and to work all of them. I want you to just think about what makes sense to you, and you just start with one thing, right? Maybe it's working on stress management, maybe it's working on diet, maybe it's sleep, and there's no right or wrong answer, because as long as you are working on health related projects, over time, you will make a lot of progress. All right, so I always end every patient meeting, every class with talking about toxins, because I think this is a topic that you might miss if you are solely working with Western medicine. There's really no counseling around this. So this is a big topic, but I'll really try to condense it down into one slide. So every day, we are exposed to hundreds and thousands of man-made toxins that are in our, cleaning products, personal care products, in our buildings. And we are starting to see many of the effects of these compounds getting into the human body. Many of them have endocrine disrupting effects, which means they disrupt hormone function in humans. And there's a link between these exposures and autoimmune thyroid disease, for example. And this is just one example among many. Also, microplastics are now becoming a very big problem. This is when plastic products break down. They are causing dysfunction in the immune system and inflammation and leading to chronic disease. We're sort of at the beginning of really understanding this, but the reason I even bring up microplastics without a lot of data is that, we are completely addicted to plastic. It's impossible to shift away, because everything from the grocery store to, all of the personal care products, everything is in plastic. So think about how far you can get throughout the day before you use something that is, is linked to plastic. I mean, it's impossible. But I think you can start minimizing your exposure by choosing different products. And so how do you decrease your toxic burden, the amount of exposure that you're getting? And I'll break it down. There are many exposures that are passive. It's in our air, in our soil, and in our water, and they're hard to minimize. But there are many things you can do. So I've put some of the most high-yielding interventions here. So getting a reverse osmosis with carbon water filter is one of the most impactful things you can do. So this is the water that you would use for cooking and drinking in your home. The HEPA air filters are really important to take out not just, exhaust or other kinds of cooking smells that might be in the house. They're also important to bring out a lot of the things that are sort of aerosolized in the air from building materials, furniture, foam. So getting an air filter is really important. And with the wildfires we've been having, I don't know how we would have survived last year without one, because at one point our air quality index went up to 600 and I could actually see the smoke in the house. So air filters do tend to be expensive, but another really useful trick is to open your windows every day for 15 minutes and just to air out the house, because as all the man-made products in your house sort of kind of go through their off-gassing, all of those molecules end up in your home. And so try not to live in spaces where the windows haven't been opened in weeks. Every day, even if it's wintertime, open your windows for 10, 15 minutes. Choosing less toxic personal care products, cleaning products is really important. And my favorite tool is the Environmental Working Group. They have a wonderful website, the ewg.org, that you can actually go in and you could test to see, you can put the name of your products that you're using to see how toxic they are. And then you can also look through their database for less toxic alternatives. And eating local and organic also helps expose you to less toxins and pesticides. And how do you, so we talked about decreasing your exposure, but how do you actually get your body to do more detox? Well, eating colorful vegetables helps because those molecules, the phytonutrients, support the liver to help you do detox. Clean protein that comes from plants helps. So this is why we talk about eating a plant-based diet. Drinking water and having a daily bowel movement helps push things through. And then a healthy microbiome. This is something that I didn't initially appreciate until I started studying integrative and functional medicine, but our microbiome, the collection of good bugs in our large intestine, actually do quite a bit of detox for us. And when we lose diversity and we lose the good bugs, we're also less able to do detox. Now, there are liver support supplements that can be used when appropriate, but I rarely go there with people. I think the long-term approach is really using plant-based foods, water, good habits, supporting your microbiome. And then, so we finished the lifestyle habits. I'm going to just quickly go through supplements. I don't really believe that people need to be on a lot of supplements. I believe in a food first approach because I think it's the long-term approach. But in certain cases, I think it's appropriate to use a supplement. For example, vitamin D is very difficult to get from most of our foods. And when we go outside, we're covered with clothing, hats, sunglasses, sunblocks. So there's very little opportunity actually to get exposure to the sun. And that doesn't mean that you shouldn't go out and get exposure to the sun, especially if you don't have a history of skin cancer. But most people do need to supplement because vitamin D is really important. It's not really just a vitamin. It's important in calcium and phosphorus metabolism. It's important for bone health, super important for modulating the immune system. It actually has antimicrobial effects. So with COVID, we've been really talking about getting people's vitamin D levels up. So lots and lots of benefits of vitamin D. I think fish oil or omega-3 is also really useful. It's hard to get enough of it from our diet unless we're eating a lot of fish and seafood. And especially if we're eating a lot of omega-6s in our diet, omega-6 fats, and not enough omega-3, as you recall, I said that leads to inflammation. So if you want to bring down inflammation and shut down a lot of inflammatory pathways, omega-3 supplementation in the form of fish oil or even algae, if you don't want to do fish oil, can help. Okay, and then the third class of tools is the complementary therapies. Now, these are low-risk tools that are an inside-out approach to health and healing. So approaches like acupuncture and traditional Chinese medicine are wonderful for getting your body's healing mechanisms revved up so that your body can actually do what it needs to do to restore balance. Ayurveda from India, also a very holistic system of medicine that can be utilized. Both Chinese medicine and Ayurveda really focus on balance and using food as medicine. Healing touch and Reiki are therapies where a practitioner may put their hands on the person's body or over their body, and it's a form of energy medicine. It induces healing and relaxation. And then hypnosis is really useful, and not everybody is hypnotizable, but a great majority of people are. So hypnosis can help with, mood, sleep issues, phobias, addiction, pain. So we have in our clinic several psychiatrists who do medical hypnosis, and they record the session for you, and then you can use it at home to utilize it at home. Other complementary therapies are craniosacral therapy and chiropractic, which is the manipulation of bones or the spine. And if you're interested in any of these, I would say read about it online, try to find a reputable practitioner. And this is a great addition to all of the other things I talked about today. So in talking about functional medicine and the different strategies for creating health, the goal is really to restore balance and to help ground and connect you so that you can move towards a higher state of health. And something I always talk about with my patients is that if you think of a continuum of somebody being, in very poor health to somebody being in perfect health, we all lie somewhere on that continuum. And I don't think that your place on that continuum is fixed. And I don't accept that we're all going to move towards, very, very poor health. I think in engaging with what we've talked about today, I think we can all move towards better health. I've never seen people engage and move towards worse health as a result. So now I don't know how far you'll move towards better health. That has to do with how you engage and basically how far along you may be along that disease process. But I think it's worth doing because these tools are powerful. There's a lot of evidence behind them. And they're safe and definitely able to be used in conjunction with whatever you're doing with your conventional Western physicians. So thank you for the opportunity to have this discussion with you. I'm going to stop the share here. And we have our Q&A section here. So I'll try to get to as many of these as possible. Okay, question, are there vegetables that can cause inflammation? So I wouldn't say that there are vegetables that can cause inflammation in every single person, but certainly many of us can actually develop food sensitivities. And the way I deal with that is I put people on an elimination diet, have them come off of certain vegetables that they think they might be reacting to, 3 to 6 weeks, see if they feel better during the elimination, and then reintroduce those vegetables one by one, each over 72 hours to see if they react. So the nightshade plants, which are potatoes, tomatoes, eggplants, peppers, and some other things, can often cause sensitivities in people, but not in everybody. And I never want to just make a blanket statement about don't eat these vegetables, because I think if we're going to stay on a plant-based diet, we need to have a lot of variety in our diet. Okay, is there a book that writes all this down? Oh, there are many. And I actually teach an 8-week class where we actually take this and we go in much greater depth. I'm trying to think of a book. Just if you Google, any functional medicine providers that have written books, you'll find it. Okay, another question about nutrition of seaweed and kelp that we've come across in health food stores. Seaweed and kelp are actually really healthy foods. They contain iodine and lots of other nutrients. So they can help with detox. So I actually, when I cook beans, I actually put seaweed, kombu, which is a type of seaweed, into the beans, the water as I'm cooking them, because it actually leaches more nutrients into my beans. So yes, I like them, but I like them as foods. So I wouldn't go out and buy supplements that contain this stuff. Oh, is there a maximum amount of fiber? I was eating 60 grams a day and had terrible constipation. So if you up your fiber intake without upping your fluid intake, you might actually get more constipated. I think our ancestors were eating maybe 50 to 80 grams a day of fiber, but the standard American diet has about 10 to 15 grams a day. So 60 is definitely on the higher side, but I think you need to balance that with eating high quality fiber that's unprocessed. So hopefully it's not Metamucil. Hopefully you're getting those 60 grams from foods, and getting a variety. And also with fiber, there's soluble and insoluble fiber. So, I generally think about soluble fiber as like the inside of the apple, the white part, and that's the soluble, and then the insoluble is that more coarse skin. And both types of fiber are important. So eat your apples or eat your vegetables, whichever ones you can eat with the peel. Do eat the peel. When I say 80%. Plant-based diet, do I mean 80% of the calories? I'm actually a very visual person, and I want you to think of it as 80% of the real estate on your plate comes from plants. Okay, so that way you can just not have to calculate numbers or get a food tracker, because that's boring. I want you to just be very visual. Go for color, go for plants, and make sure that the vast majority of your plate is taken up by plant-based foods. Okay, are there times of the day when one should not exercise? I would say that everybody is different. A lot of people tend to be kind of stiff and creaky and early in the mornings. So they don't really want to kind of move early in the morning or do, running that early. Some people feel like if they exercise late at night, it might keep them up. Some people exercise at night and they feel that helps them go to sleep better. So the way I would answer that is, I think you should experiment with exercising at different times throughout the day and see what works best for you. First of all, it's your schedule. So when can you get it in? The best time to exercise is when you're actually going to do it, and do it regularly. A lot of people tend to have their best physical coordination at like 2 to 4 in the afternoon. So if that works better for you, great. But there's no wrong time to exercise. Okay. Say more about fasting. Okay. So fasting is always done with water. You never want to limit water intake during a fast. There are many, many different regimens, and this is a very hot topic. Dr. Jason Fung, F-U-N-G, does a lot of work in this area, and I really enjoy learning about fasting from him. He's a nephrologist who has written a lot of books actually in this area. So some simple fasts are doing an overnight fast, where you are having an early dinner and then delaying breakfast in the morning. Most people call that intermittent fasting, but that's actually time-restricted feeding. Start with 12 to 14 hours a day between dinner and breakfast. And then if that feels good, you can lengthen it. If you're diabetic or have unstable blood sugars, I would be very cautious, and I would talk to your doctor before starting to delay meals, especially if you are on medications that lower blood sugar. I generally don't like juice, because juice tends to be sugary, and we want to kind of just rest the GI tract. I don't like juice fasts at all, actually, because it doesn't make sense to me. Yes, you want the phytonutrients, which are all the colors, but I think better off just sticking to water, maybe some herbal tea, maybe some green tea. If I do a longer fast where it's 48 hours, I might have some green tea on day 2, just because I can't get through the day otherwise. So we talked about that overnight fast. There are other types of fast that I can't get into today, but intermittent fasting is another one. Fasting mimicking diets are another one. But the easiest way to start is just overnight between dinner and breakfast. And you have to do that 4 to 5 times a week for it to really start making an impact, and hitting all of those bullet points that I had on the slide. Okay. Best foods to battle osteoarthritis. Plant-based foods, really. And one thing with arthritis is sorting out food sensitivities. So maybe going off of gluten and dairy for 6 weeks to see how you feel, and then reintroducing them back to see if they cause you more trouble. With arthritis, I also tend to want to have people cut out the nightshade plants. But again, you want to eat an anti-inflammatory diet because the itis at the end of osteoarthritis is inflammation. So you want to be anti-inflammatory. Where does dairy fit into the diet? Dairy has some benefits. It's a fermented food. If you are not sensitive to dairy, it's fine to have it. But I generally think it's better to stick to the plant-based fermented foods. Some people have trouble tolerating milk, but they can do cheeses or yogurt, and that's fine. I don't think it should be a major part of your diet, but if it's something you eat and you're not reacting to, great. But if you have an autoimmune disorder, I would highly recommend cutting out dairy and gluten for at least 6 weeks to see how you feel and then reintroducing it back. Okay. Let's see. Well, this is a lot. I don't know if I'm going to go 5 more minutes and I'll try to get through as much as I can here. So someone asked what about exercising in and playing in a power line park and electronic devices? This is a hard one because these are some of the exposures that are hard to avoid. I would highly recommend not buying a house near power lines, not having your phone near your head, or especially when you're sleeping, just putting it in airplane mode if it must be in the room with you. So electromagnetic radiation is something we have to think about. Actually, the Environmental Working Group has some really great tips on how to minimize exposure. Is coffee okay? I think if you overdo coffee, it can actually kind of throw off your cortisol levels because it's sort of, giving you this caffeine boost. I think if you like coffee because it's social and you enjoy the taste, that's fine. But if it's the thing you must have in the morning to get going, that's more problematic. So just make sure you're not addicted to it. Let's see. Someone's asking about how to do a detox, who has diabetes. I would start with food first. In my classes, I give out food plans to everybody, and one of them is a detox food plan, and it gives you all the information that you need to know to figure out how to start working with food, and then water, daily bowel movements. I think that's the long-term approach. What's the best kind of provider to help figure out food allergies? Well, I think a lot of nutritionists actually do a great job, or functional medicine or integrative medicine doctors. It depends on what your insurance covers. Is reading a book on Kindle okay? I think reading a book on Kindle is better than reading it on your cell phone because the light that's emitted is different. But I'd rather you just read a paper book. A speaker takes more than 100 supplements a day. Do all integrative doctors rely on supplements? Well, again, it goes back to having a food first approach. So I do have patients that come in with 30, 40 supplements, and there are some studies out there that show that doing isolated nutrients like high dose vitamin C can actually not be as helpful. In fact, it could actually be throwing off your biochemistries, but doing it with food is very safe. So this is why I always talk about doing it with food. Okay, well, I'm going to stop there. I'm sorry if I didn't get to everybody's questions because there were many, and thank you for your interest and for your curiosity. I really appreciate it. This is a fun area to talk about, and I really enjoy learning about it. But I'm certainly happy to I have many classes that I offer through the Integrative Medicine Center, which can really kind of drill down into all the details. So this was just an introductory talk to kind of give you the quick and dirty on what we do in that integrative medicine clinic.
Thanks very much, Dr. Payrovi. This was a really great introduction to this subject. And for the audience, this talk has been recorded and it will be up on our YouTube channel within another couple of weeks, and you can review it. And as Dr. Payrovi said, you can look up her classes in the Integrative Medicine part of the Stanford website. So thanks again. This was a terrific talk. So much to think about. Really enjoyed it. And good night to everyone else. Good night.